off and going. So apologies. Any apologies from anybody at all? No. Oh, Councillor Pandy running a few minutes late. He'll join us as soon as he can. So item 2 is late items to be introduced by the chair, and there are none for this meeting. Item 3 is declarations of interest. Any declarations from anybody at all? No. Fabulous. So minutes of the meeting held on the 31st of March 2025. Need to agree that they are true and correct records. Anybody any issues with the minutes at all? No. Fabulous. We'll take those as agreed. Perhaps that brings us on then to item 5, so housing services, homelessness and rough sleeping update. So Claire and Carl, over to the two of you.
Thank you, Chair. Thank you for inviting us to come and give you an update on homelessness. I think looking back at our records, the last time that homelessness came to a scrutiny meeting was back in 2021, so it's been some time. We had a brief in terms of homelessness as an update, and you'll appreciate that that is quite a big brief. So I've tried to cover off a bit of all sorts, but also focusing on I think where some of the particular interests lay around plant usage, what they're achieving, and also looking at what our next steps are in terms of that grant usage for this year, any successes that we have had that we can demonstrate, any lessons that we've learned along the way. And I think that you'll find, hopefully, not death by PowerPoint, but a few set of slides just to, as I say, give you some evidence-based information rather than just me talking anecdotally. So if we go to the first slide, I'm going to try and cover. I was told we've got about 45 minutes for this slide. I'm not going to talk for 45 minutes. Don't worry. But I think just in terms of setting a bit of background around the national focus and how that's impacting on us locally, and then I've looked at 3 key areas. So homeless approaches, a 5-year kind of view as what's happening with those. Use of temporary accommodation, 5-year again view as to what's happening there. Street homelessness, 5-year view as to how that's moving. And then I'd say into the grant. Benchmarking with our nearest neighbour group, so how we're comparing as a city, comparing it against similar sized unitary authorities, what we consider to be key successes in Derby, and then a bit on next steps. Hopefully that covers the 3. If we just go on to the next slide, in terms of national landscape, and as I say, I'll look through these because they won't be a surprise. Insufficient available and affordable housing, it's a national issue. It's not surprising that that translates to being a local issue as well. Poverty and welfare issues, we know that we still are feeling the effects of the cost of living crisis. We know that from a welfare perspective, there are some national decisions being made by things like local housing allowance and capping the rates of that year on year, which means it's more difficult for people to be able to rent in the private sector and claim enough benefit support to be able to maintain those tenancies. Renters' rights legislation is on its way, again, in terms of the national policy, and I think in terms of homelessness impact, I think it's fantastic through a lens of improving quality and tenants' rights in terms of getting rid of no-fault evictions. But there is potentially an unintended consequence that might happen in terms of accidental landlords maybe leaving the market as the market becomes more difficult for them to navigate. So it's something that we are watching. Temporary accommodation pressures, you can't really turn the TV on without discussion around how much use of temporary accommodation has gone up. Large drivers of those being around insufficient accommodation, insufficient affordable accommodation, poverty and welfare issues that do tend to go hand in hand. There is a Supported Housing Act which came in 2023 but is yet to be enacted, and again this is all about improving the quality of supported housing, which through that lens is really welcome. But again, if we start to see supported housing price exit the market, then that has the potential to put additional pressures on the local authority in terms of homelessness. And a asylum and migration policies, prison release schemes, both nationally driven agendas, where we are seeing some additional pressures on the homelessness service in the city, and that's again the same nationally as it is locally. Just on to the next slide. So again, in terms of the local landscape, we are seeing, just mirroring the previous slide, we don't have enough affordable, available homes in either the private rented sector or social housing sector. Certainly in terms of the social housing sector, there are very long wait times for social housing, and all of these things contribute to homelessness or being able to move people through council's homelessness statutory duties and into a more forever home. And I've referenced again here around insufficient available, affordable and suitable move on options, because we also find in the use of temporary accommodation that moving people on may mean needing to move them on to some sort of supported housing, so kind of links to the other legislation, but also links to the availability of supported housing and the right supported housing and the right package for individuals and what they might need. It is the same those tenancies. We are seeing an increasing number of individuals with low or no support needs spending one or more nights street homeless. This is a new phenomenon for us, and again, I think this is one that is being borne out nationally as well as locally, and some of it is as an unintended consequence of some of those national decisions being made, let's say particularly around early prison release and around the backtracking of asylum cases. And I think that we are locally developing a commitment to better connectivity between health, social care, housing and homelessness. And I think, again, reflecting back on the national position, that still seems, it still feels quite siloed in terms of the legislation and the money that comes to deliver those services not being as connected as it could be, which makes it more difficult to connect that together at a local level. Go to the next slide. So this is the 5-year trend, so just 3 slides. So in terms of homeless approaches, what we often hear people talking about is homelessness is going up, it's going up, it's going up nationally. Our approaches, so the number of households that approach Derby City Council for homelessness assistance is not going up, and it hasn't been going up for the last 5 years. It's been relatively stable. What we are seeing is that more people are coming to us once they become homeless. So the opportunity to prevent their homelessness is reduced, which is what you can see in the if you look at the pinks, these are people that have come to us before they become homeless, and the blues are those that have come to us where they've already lost their home. So you can see that although the number of approaches is broadly stable, something is happening in terms of people approaching us later. Next slide, please. Temporary accommodation. So I've given you there households placed in temporary accommodation with children and households with children specifically in bed and breakfast. Tells somewhat of a sorry tale in terms of the increase of placements made. Back in 2021, we were on 111 in a year. Last year, we were on 462, and it's been a year-on-year increase, jumping significantly in 2023-24. It came somewhat out of the blue, so unsurprisingly, the correlating numbers of households with children in temporary accommodation went up steeply in the last 3 financial years. We have been trying to respond, particularly in terms of children in bed and breakfast, which is quite possibly the worst form of temporary accommodation. And so there have been some initiatives running that are driving down the numbers of households with children in bed and breakfast quite significantly. If we look at that third column, last year we were down to a snapshot of 17 versus support. That is due to a couple of things. One being that there is a current delegated decision that Sam made for 6 months to be able to use council houses as an alternate for temporary accommodation for homeless households. So 2, 3, 4 bedroom council houses are being held back and either converted into local authority owned temporary accommodation or being used for move on from people in temporary accommodation into a council tenancy. So that has been impactful. We also had the council's purchase of Abbey Lodge, which brought another 47 units of accommodation to use for temporary accommodation, where we targeted the biggest families and the most expensive families that were placed elsewhere into that, which has helped again. So there are a couple of initiatives running to try and reduce down the numbers of households with children in bed and breakfast that feel like they're working, but against a backdrop of a huge increase in the use of temporary accommodation, not just in Derby, but nationally. Just look for the next one. And again, rough sleeping, street homeless people. Some people don't like the term rough sleeping. Some people use the term street homeless. I've kind of interchange it. But in terms of rough sleeping, again, there's a picture here that almost tells two different stories. So in terms of that, every year the local authority does an annual estimate of number of rough sleepers on a given night, usually on a date in November. And it's verified by Homeless Link, and we bring partners along to that. And we look at both the numbers that we see on the street on that night, and also for anybody that we know is routinely sleeping on the street, but didn't appear to be there on that night. They're built into the estimate with partners to try and give the truest picture, and most local authorities choose to give an estimate as opposed to a count. So you'll see that in terms of our numbers officially as a snapshot on that date in November each year, Derby's numbers are low, but growing, but still not low in comparison to, again, our nearest neighbour group. If you look at the numbers, the actual number of people who are sleeping in the city, as opposed to how many are sleeping on one night in November, you see a huge growth from 186 only a couple of years ago to 530. So a huge growth. But what we're finding is that those are not entrenched with sleepers. These are a different profile of people entering street sleeping. These are people that are maybe staying for a night, a couple of nights, and moving on. Whereas if you were to go back a couple of years, you would find many more numbers of people that are routinely and persistently sleeping. So grants, from a government perspective, Ministry of Housing, Communities and Local Government recognise that there's the need for additional support at a local level, and we have access to two main grants, the Homeless Prevention Grant and what was the Good Sleeping Initiative grant. So I've tried to break down in terms of both grants what we were allocated last year and what we spent it on. And it broadly, so for Homeless Prevention Grant, we were allocated £1.4 million in Derby City, and that money got broken down to essentially staffing and projects in the city. So as we have more homelessness to deal with, and as we want to move towards preventing more homelessness than we currently do, we have increased our staffing around homeless prevention. Safeguarding, again, as we have more homeless people, more safeguarding concerns are raised, and we work with the council safeguarding team to fund a dedicated social worker to safeguard homeless households. Greater use of temporary accommodation, we need more staff to be able to administer that. And we fund into the welfare rights service, again, in terms of trying to prevent homelessness or relieve it as and when it occurs. The sorts of projects that we are supporting through this grant, rent deposits, landlord incentives for the private rented sector, either to stop people becoming homeless, or if they are homeless, to be able to access the private rented sector. we certainly know that if people are in receipt of benefits, their ability to access the private rented sector without support for month's rent in advance, deposit, and often also covering off shortfall between what they can get through housing benefit or their income support and what landlords are charging, just leaves a hole. And without this financial support through this grant, they won't be able to take tenancies. So we spend a fair amount of grants in the private sector. We also fund enhanced supported housing pathways. So supported housing at the moment is paid for through housing benefit, through supported exempt accommodation. We have found that the level of care support supervision that has gone with that housing doesn't always match the needs of individuals who become homeless. So we have funded higher levels of housing related support to be able to match the needs of those who present as homeless, because we were finding that otherwise they were just slipping through the system. So they were going into support housing, getting evicted, going into support housing, getting evicted. So there needed to be an enhanced level of what could be expected. So we're funding that. We're funding the Safe Space Partnership, which is a partnership with police and crime commissioners to provide the safe space, which is a kind of rest and recovery hub for those that become homeless in the city. And we are funding homeless prevention, promoting support, so services that are able to negotiate between landlords and tenants and the local authority to try and stabilise tenancies when they start to wobble a bit. In terms of our nearest neighbour group, we have to do statutory returns in relation to all of our grants, and we compare how we're using our grant and its benefit with our nearest neighbour group. And again, you'll see in terms of homeless prevention successes, we are outperforming our nearest neighbour group, and we're outperforming our success rate on relieving homelessness in the city, quite substantially more than our nearest neighbour group. Go to the next. So for me, it's that right-hand side kind of puts into context why we're spending on the left-hand side, and we appear to be spending in the right places and performing better than our corresponding peers. Again, the Rush Sleeping Initiative, last year our allocation was just over £1 million, and again broken down into staffing and projects, but targeting rough sleepers. So again, homeless prevention work to prevent rough sleeping. It funds the outreach service, the street outreach service, which you might have heard of as the BEST team, who are out there trying to engage with rough sleepers and engage them into services. We also fund some in-reach services for private sector placements. So then again, for those that have a history of rough sleeping, moving into private sector accommodation can require some ongoing support. So we fund to enable that to happen. Similarly, we fund rent deposits, landlord incentives. Some sustainment funds can cover some early setup costs of private rental sector. If you're coming from the street, there aren't any furniture or bed or anything. So we fund in to help some of that basic setup. We also fund in for to support a housing first model, which is where the local authority provides the accommodation. We purchase in a wraparound support service that goes to the accommodation. It's not linked directly to the accommodation, so whether or not the tenant chooses to engage with it is their choice, as opposed to supported housing, so it's something different. And that in particular seems to work really well, where the level of choice is given to an individual as opposed to kind of us deciding what we think they need. And we are funding, again, further contributions into the Safe Space Partnership to enable it to be open 24/7. Without the funding from here and the other grants, we would be on hours a day, which just wouldn't serve the needs of the city. And we're also funding into what we term transition and resilience hubs. So these are again how do you make the move from rough sleeping, it not being all about there being a roof over your head, because quite often when you to speak with those that have experience of rough sleeping, that's the least of their concerns. So it's how you work on a broader perspective to try and support that tenancy ultimately to be maintained. So we've got some outcomes on the right hand side which picks up some of what we've already said. So 530 individuals, as I said, found for sleeping last year. In terms of the safe space and its value, an average of 123 individuals supported by the safe space each month. There's a lot of traffic that goes through those doors, and they provide an overnight space as well as rest and recovery in the daytime and access to social care and care support. We've got a 96% success rate of entrenched rough sleepers sustaining their tenancy through the housing first model. Very small model, 6 a year, 6 properties a year. But that's where I would say that the investment in that model and funding of a wraparound support that is the choice of the tenant rather than a supported housing imposed choice that we might make, is having really, really good long-term success with some of those most entrenched rough sleepers. And we find that locally, but there's a wealth of evidence nationally that this works, and internationally that this works. It's just expensive. At the bottom of it. Just go on to the next slide. Again, just a little bit more benchmarking. So target priority group, because again, it's a Ministry of Housing term, and it references the most entrenched rough sleepers, and we have to track that group in terms of whether what we're doing, what we're providing is having effect. And then a most difficult group, we group them together in terms of getting longer term successful outcomes. But we're able to evidence last year that 56% of our most entrenched rough sleepers were housed in what is considered either medium or long-term accommodation. So it's not that kind of short-term bouncing in, bouncing out, bouncing in, bouncing out. There's over half of those that we've worked with are in longer-term housing, which is really positive for the group. And again, in terms of our long-term rough sleepers benchmarking, when we look at our nearest neighbour group, again, we are outperforming most of our nearest neighbour group in terms of outcomes. The next slide, please. I've nearly finished. So grants for this year, lots of grants, slightly changed names, slightly changed parameters. So the homeless prevention grant has gone up, but within the story of it going up, it now includes winter pressures grants. So last year we had 3 very last minute awards from the Ministry of Housing of additional funding for winter pressures. This year we've rolled them all in at the beginning, which is really helpful because it helps us to get a plan. But it means that you can't compare last year's grant and this year's grant, kind of say, oh, look at the increase it's rolled in. It was about £500,000 worth of extra grants that we got last year in 3 instalments between, I think, December and end of February. In terms of the rough sleeping initiatives grants, it's been around for a few years. It's been rebadged as the rough sleeping prevention and recovery grant. And again, it's incorporated what was the rough sleeping initiative grant and a couple of smaller grants, particularly one around ex-offenders. So when we put those together, the money is broadly the same. In fact, I think on that one, it's slightly less than last year as combined. As to what we're spending the money on this year, the same as we spent it on last year, I think is the top and bottom of it. What we're spending it on seems to be working, seems to be holding. There isn't a lot of extra money for us to do more. and I think it does feel as though we are on the right tracks in terms of where our current spend is. I think we might be to the final slide now. Benchmarking again, I just picked up probably three of the easiest indicators to recognise around homelessness, comparing us with both our nearest neighbours, which are say similar sized local authorities and unitary authorities, and also the East Midlands average, just to give that picture. So again, in terms of households over homelessness duty, Derby went up 9%, nearest neighbour 16, East Midlands average 16, so we seem to be performing better in that area. Total families over homelessness duty, again, we seem to be containing by the preventative activities that we're funding the increase at a 12% level, nearest neighbours 22, East Midlands average 20. And our rates of rough sleep, with people rough sleeping, again, seem to be outperforming certainly our nearest neighbours and also our East Midlands average, even though we are seeing increases. So you imagine what they're seeing, because what we're seeing feels pretty bad. But yeah, everything in its context. Go to the last slide, I think it is. Local successes. So there's a list there. I think I've probably spoken about most of that already. Perhaps the bits that I would put out is in terms of private sector support. So I talked about private sector initiatives. We do spend quite a fair bit of grant support in the private sector to either pay for deposits, rent in advance, or to stabilise tenancies that are in crisis. And last year, just to give you some numbers on that, 378 households were successfully housed into the private sector. So that wasn't the stabilising ones, they are new tenancies of households that became homeless or at risk of homelessness. We are taking, as I've mentioned, some innovative approaches to how to manage temporary accommodation demand. I think the delegated decision to use council housing was a really good one. The purchase of Abbey Lodge is a really good one. They are meaning that not only are we providing better quality housing and family housing as opposed to bed and breakfast, which is at the other end of the spectrum, but we're also reducing subsidy loss associated with those. So it feels like we're getting two lots of wins out of one, kind of one driver. We do have very good cross-agency working around the homelessness agenda, both with the statutory partners and also charitable partners, the supported housing sector, very, very good networks, and kind of try and get all of our heads around collective issues. And the last couple of ones, again, in terms of, I was talking about streamlining housing pathways for complex cases, so we don't just go to the market with a one-size-fits-all, because we know that that doesn't work for some people. And we've been working with, the council has been working with supported housing providers in the city to develop a pre-eviction protocol. So again, where those supported housing placements start to wobble, that there's more support available to those providers. They don't feel on their own, where the only decision they're left with is to evict. There will be occasions where eviction is the only option, but I think it's just having that earlier conversation allows us to try and put, again, collective heads together. This is the last one. So what's coming around the corner this year that is taking into account homelessness and will hopefully have some positive outcomes. The council's housing allocations policy is being reviewed. It will be coming to cabinet. I think it's aiming to come back end of this year, and that is looking to recommend some changes, particularly strengthening things like local connection protection. So at the moment there is, thousands of people sitting on Home Finder waiting for properties. Um, we are at the moment using more council properties for temporary accommodation. There has to be therefore the acknowledgement that these people sitting on this list are less likely to get a council property than they were previously. It's not all wins, there were winners and losers for these decisions. But we need to make sure that where we are allocating the council's housing stock, that we are allocating it strategically to make best use of the council's assets. There's a refresh of the homelessness and rough sleeping strategy again. So the current strategy is 5 years old. The council are currently undertaking a refresh with some consultancy support. It's going through a round of consultations, so the public consultation on the housing allocations policy and the homelessness and rough sleeping strategy. The council are developing a private rented leasing scheme. Again, this is another option for the council to be able to lease directly from private landlords and then use that accommodation as temporary accommodation. So rather than facing with the private sector, use the private sector properties in, and then you're effectively placing them into your own local authority stock. So that is being again led by the strategic housing team in the council. We bid successfully for a single homeless accommodation programme, SHAP, it's known locally, a SHAP bid to be able to buy a property on Wilkins Drive and test the concept of providing on-site care, on-site support to those with the most severe and multiple advantage, which is a term that is used to describe those that have an enduring rough sleeping background and are affected by multiple disadvantages, which may be care leaver and with health problems and potentially mental health issues alongside the rough sleeping. So you kind of layer all these things on. And so we were successful in bidding that grant. The council used that grant to part from the purchase of the building, and there's revenue grant coming to provide a dedicated support service at Wilkins Drive, and the council's social care team have top-sliced some plans to provide an on-site care facility. So again, it's a test of concept to answer the question, what do you do with those most entrenched rough sleepers that have multiple disadvantage, that are bouncing in and out and nothing is working, because they're the ones that most people will recognise walking through the city centre and want somebody to provide some help or do something about, depending on which, how you approach it. So that's a test of concept, we're really excited about it, but I can't profess to say it will be a roaring success. We are targeting the most challenging group, but we are at least targeting them rather than having no plan in terms of what to do with them. And I suppose just finalising with our hope and expectations is that we will continue the strategy as I've kind of set out as to why we're doing what we're doing, the fact that we're bringing a level of success in comparison to our peers, and that we need to continue to focus on preventing homelessness wherever we can, relieving homelessness as quickly as possible, and eradicating rough sleeping with options that are available for everyone that needs it.
Fabulous, thank you, Claire. That was a whistle-stop tour, but very, very detailed and very informative report, which I certainly appreciate. I'm sure that the whole committee did as well. I'll open up to everybody for any questions at all. Yeah, Councillor Planning.
Thank you. You mentioned housing first. So obviously, we all have seen how the housing stock is not up to the demand. Everything is quite high. What talks are going on? Like, are you looking at some models where strategic housing can be developed for Derby homes need, maybe smaller apartments, one-bed studio, or like affordable homes or sustainable homes? are there any talks going on at the local level and also with the national government to look at the whole picture, how we can increase this stock of accommodation and then maybe move people.
Yeah, so I kind of toyed as to what to put in this presentation because there was a whole other presentation in terms of how the council is responding to housing demand. And I suppose rather than me try and talk on behalf of Ian Gallagher, who would be the responsible director, probably it's an option for you to ask for a presentation on housing, how housing supply is meeting housing demand, and that would really be my recommendation. I don't feel like I would do it justice.
You didn't mention housing first in your presentation.
Yeah, so Housing First is a specific project which is targeting, again, it's trying to target some of those with experience of rough sleeping or still rough sleeping who are failing in supported housing, failing in temporary accommodation placements. And so the difference with that particular model, it's a really small scheme. It's only 6 properties a year, and it has a wraparound support that goes with it. And the difference between that and other supported housing is that you are allocated the tenancy without expectation that you have to engage in anything around your support needs. But all of that support is built there, ready and waiting. So it's this idea that what people actually want is their own front door, and what do you deal with first? Do you deal with giving somebody their own front door, or do you try and deal with all of the reasons that led to them becoming rough sleeping? Which, if you go down the second one, you're probably doomed to failure because you find a roof, but you can't keep a person in the roof. So there is this kind of issue of like, okay, well, if you find the roof and don't put an expectation on the person, they have to do something because they're quite often people that are institutionalised, so they balk at the concept of being told what to do. And I'm being really generalised here, but there are 2 things that the Housing First model addresses, but for very small numbers of probably some of the most challenging ones to accommodate, which is, I think, different to your question, which is very much about what we're doing about supply.
Taking place to look into this.
Yes.
At the moment, we're not building any houses. We're not going to go to do it unless we have discussions in that direction.
Yeah. So there most definitely are discussions taking place, and there are plans. But I think, as I say, as a scrutiny group, you could ask for that, and then I think you'd get all of the detail of that.
I think if nothing else, go on, I've given us something for the work programme, but we can pop into that. Councillor Khan, you're next.
Yeah, I think, I don't know if I missed it or not, but I think you mentioned staffing. How much staffing you have for rough sleepers, outreach workers, social workers, in-house workers? I don't think I've seen that.
Yeah, in terms of the actual numbers.
Numbers, yeah.
So,
and the second question is, you walk through town and you see similar faces. Yeah, rough sleepers up Normanton Road, top end, in middle of town in East Street, further up. Yeah, you see similar faces. Are these people outreach workers going to them, or are they been in accommodation and they've left?
Yeah. So there's a real mixed picture. If I go backwards, so there is always a issue around is somebody a rough sleeper or if they look like a rough sleeper in terms of city centre management, because what we find is that there's a mix of both. So there are people that we identify that we think are rough sleeping that actually have accommodation and they are staying in it, but they're out in the city centre and people perceive them to be a rough sleeper. They might be begging, and they might look unkempt, they might be, thinking all the things that our minds tell us there's a potential to be a rough sleeper, or we find they're not a rough sleeper, and we find some that are rough sleepers. So I think in terms of those similar faces, we have 2 different groupings that we work around. So we have a multi-agency rough sleeping hub that focuses from a multi-agency perspective of those that actually are rough sleeping, and we work to engage with those and bring them in on the streets and work as a hub, including statutory, voluntary, charitable organisations to that endeavour. And then we have a group that is effectively behaving in an antisocial manner in the city centre, which is more public order, community safety, and we have a group called the PEP, which is focused on enforcement. So they are then looking at, okay, how do we stop these behaviours in the city centre? The PEP bit is run by the council's community safety service, and the homeless bit is run by, well, it's coordinated through Derby Homes on behalf of the city council. In terms of staffing numbers, so in terms of the grants, the staffing numbers are very few. So we fund a dedicated social worker within adult social care. We fund, in terms of outreach, I think we have 8 outreach workers. In terms of homeless prevention, so we've tried to put some additional resource at the front end to prevent more homelessness. I think we've funded up to 2 posts from within these existing grants. So it's in those ballparks in terms of staffing numbers. In terms of the statutory level of homelessness services and everything that goes with that, there's probably 80, 90 staff. The big area.
That's Councillor Rawson.
I've got 2 or 3 if that's all right. So the first one is to ask whether we still have the night shelter type provision, Hadley as was. So, for example, if I were 6:45 tonight, I phone up and say I've got nowhere to sleep tonight, would there be a provision of a bed for me if I needed it tonight?
Yeah. So we don't have a Padley type model. We don't have a night shelter model. What the concept of the night shelter shut down during the pandemic because when public health guidance was that you can't use big rooms to put lots of people in. Some local authorities have started to move back to a night shelter type arrangement. In Derby, we haven't done that yet, but it's something that we are in fact currently exploring and working through the options. If somebody were identified as rough sleeping at 7 o'clock at night, they can call through to the council's care line out of hours service, and they will be accommodated in a bed and breakfast for that night. And then we would bring our homelessness service to engage with them the following day, because we need to establish, do they actually have somewhere that they could stay, or just choosing not to stay there? What is it that we actually need to do with this individual? But our position has been for several years now that nobody needs to spend a night on the streets, and that if it's out of hours, it's a phone call through to care line. People can report if they see a rough sleeper through Homeless Link, and that will get reported directly into us in terms of where the location is. We do our street outreach at 5 o'clock in the morning, so we can go and identify them if they're reported through that national reporting mechanism.
Next one, maybe for this one, but you mentioned about landlords potentially exiting the market. Is there a possibility for Derby Homes to buy more houses on the open market, ex-council properties, whatever, and bring them into the council's housing stock?
Yeah, I think the short answer is yes, and probably would be worth feeding into that scrutiny topic.
And in terms of the council stock going increased use of temporary housing, you sort of touched on the potential downside of it in terms of that being then less available for people on home finding to access. Does it not also impact people who we accept homeless responsibility for, because if there's less permanent tenanted properties for everyone else, there's going to be less tenanted properties for people who are accepted as homeless to move into as well. The risk of them just getting stuck.
Yeah, I mean the delegation that's currently on is to use council-owned 2, 3 and 4 bedrooms, either to convert it to more temporary accommodation social housing, as well as use more of it for temporary accommodation. The issue, of course, is that there's enough of it. So I think it comes back to that discussion around supply and what plans there are in terms of expediting supply, both of social housing but also private sector housing, because there is a need for both, and private sector housing that's affordable.
Finally, the answer to this one's probably supply as well, but yeah, I sort of need to raise it again on behalf of the residents. And you mentioned the stats show that people are approaching much later now, and I think that's my experience over the years has been that it's difficult, very difficult to get anything sorted out in advance just because of the lack of properties that are available. So what often happens is that people have to get in writing that they're going to be evicted, and there's a long process through the courts while that happens, while they're in limbo. And then it actually comes to the day when they're being evicted and they've got to leave, and it's only at that point that people actually find out that they're going to get another property, or where they're going to move on. So as I say, the answer is greater supply, but is there anything that you can do to sort of try and improve that experience for them?
So if you had infinite resource, those people that, how the Homeless Reduction Act is written, the local authority duties kick in when somebody approaches the local authority 56 days or less before they actually become homeless. If they approach the authority 65 days before they become homeless, what the local authority offers is basic advice. If they approach 56 days before, then the local authority has homeless prevention duties, which kick in and require resources. So there is an issue of, because I think what's been said to me often is, well, you need to get to people earlier. Absolutely agree, you need to get to people earlier. But the resource allocation that we've got is to deliver the council's statutory duties, which kicks in at 56 days before. So if you had more resource, you could do more things earlier. I think is in kind of answer to your point. I also think one of the drivers why people are coming to later in the day is because what's going to happen looks worse and worse. So, in days gone by where you had low use of temporary accommodation, much higher turnover of social housing, the road, a homelessness route didn't once filled with trepidation. Now, if you're coming to the local authority for homeless assistance, you are in all likelihood going to be placed in bed and breakfast, then you're going to be moved to place as a family in bed and breakfast, if you're homeless. Then you're going to be moved possibly into private sector placement. Then you might be moved into a council's own property, temporary accommodation, where you might sit for an awful long period before being supported to move into the private sector, because there isn't the council house turnover. So the eye line of becoming homeless and what the local authority can do feels not something that you really want to run at. So therefore I think that people are trying harder to resolve, maybe stay with friends and family temporarily. This is holding for a bit. Well, okay, we don't need the local authority. And by the time they come to us, they've kind of exhausted. They've tried to rent in the private sector. They've realised what benefit they can get. It's not enough. They're not going to have to pay for it. So we get more people, I think, that have tried to resolve their own issues and failed. Certainly, I feel we're seeing that a lot more than we used to, which I think comes back to kind of the impact of cost of living crisis, COVID, and all of the things that we're still not entirely over.
Councillor Cook?
My question was just the same as Martin's last question, is that it's interesting to see that the amount of people that are getting into contact with us will be the same, but people are getting in contact much later, and the fact that it's changed over the years. So I think you touched on some of the reasons. In my head, surely early intervention is easier, but you've explained that the 56 days, and I think that makes a difference. I guess what my question would be is that do you think people are less aware of the services that are available than previously before? So in the years that people were getting in touch earlier, could it be that we were advertising the services more openly, or do you think that might be?
Yeah, I can't say yes or no. Either way, I think what I'm nervous about is if we further promote the services, we will see further demand, and there is a balance to be had in terms of people. Yeah, it's a bit of a Noah's Ark, isn't it? I don't know a good way of saying it really, but if we further promote, come to us early, we will get more people coming to us early. We'll still be applying the 56 days before in terms of statutory duties. The ones that come to us earlier than that, we just simply don't have a resource allocation to be able to meet that demand. So if we promote more of it, we are going to struggle. So I think it's not as easy as work, even if it is the case that we're not promoting in a way that we did a couple of years ago, there's a risk to promoting more than we can chew. We struggle to chew what's within the statutory requirement in terms of numbers.
I can just ask about how we're promoting them as well. So in terms of accessibility, the example was about somebody calling. If someone's at the last stage financially, they might be out of contract on their phone, and not everyone can access the internet in the same way. So we make sure we're covering all the accessibility bases in terms of how people can get in contact if they need to.
Yeah, I think we are. I think we're doing okay, is what I would say. So the government brought in something called a duty to refer. So statutory services wherever they present. So if you present at hospital, if you're working in social care, if you're working with the criminal justice system, and you talk about the fact that I might be homeless, then those organisations have to refer them to us. So whether it's that the individual doesn't do it, the statutory service does. That helps quite a bit in terms of catching people, because that duty makes that happen by law. We have really good links with other support services and like the welfare rights team. So what you might find is that somebody comes and contacts the welfare rights service about worries about their rent, but we will get that connectivity into the homelessness service. They don't have to come directly to us. We've got the usual, the website stuff. We promote our Facebook and other social media in terms of how to contact us. We do press releases around the services that are available, particularly winter months, where we know that there will be added pressures, telling people what we offer, what we don't offer. We do some positive press stories wherever we can. Press tend to like more negative press stories when it comes to home to sleep, and we try and promote the services. So I think we do okay. But we know that we've got some pockets where we do less well. We certainly know that we've been doing some work with harder to reach groups, hidden homelessness, and some of the barriers to accessing statutory services from certain groups within the population, where we're trying again to work more closely and to have advocates in the community that can have access to that information so they can share it when people approach them, as opposed to having to approach the local authority directly. So I think my assessment would be that we do okay, but I'm not sure that everybody in the city would know what to do if they were worried that they may become homeless, despite all of our efforts and endeavours to have those sort of kind of channels of communication.
Councillor Fatt?
Thank you for the presentation. I've done quite a bit with Helen homes, talking to different people, and I've met the outreach
Paddington, there's always been a sort of history of people standing there like this. And I've tried to dissuade them from that and talk to the outreach team. So I've always received a very positive response from them, because most of the people that are referred to the outreach team don't actually need their services. But they sit there with their hands out, but they haven't, they've got somewhere to go. Last winter, I was going to a soup kitchen off Traffic Street, and there was an awful lot of people attending that. I think the most I witnessed in one night was 54 people queuing up to get a hot meal. And again, one of the problems for you, some of those people could be helped, and some couldn't. They didn't want help. They were happy sleeping in the doorway, smoking whatever they could get hold of in the daytime and drinking whatever they could when people would give them some money to go buy. But what do you do with those sort of people that they sleep rough and they will always be on our statistics? What do you do with those?
Yeah. Well, I think and it's a really jumbled landscape, that, isn't it? Because as you say, you've got some people where there is a perception that they're full sleepers and they're not. So they're not going to sit on a plan.
Yeah.
They're going to sit on city centre management plans, community safety plans. So I think we're always going to have that. We're always going to have people that don't want to engage with what they see as an establishment, be it the local authority, the outreach team, the anti-establishment, don't want to engage with any of that. And again, it is people's right to choose not to engage, whether we like it or we don't like it, that is their right, and their right. There is legislation coming to repeal the legislation around it being a crime to rough sleep. So, that we can't force people. So we are always trying to talk about the benefits of engaging with it and what it is that we, what life means. But, we know that some really startling statistics. I think the average age of an entrenched sleeper is something like 42.
Yeah, I mean, most of the people that
that's quite a sobering conversation to have with an entrenched sleeper. It's just that you do realise that life expectancy is going to die.
Again, I saw one lady, and she came with a 54-year-old son, and she was 83, and she came every Friday night for something to eat. I did find out later that she had got a home to go back to. I don't know what she was doing on Traffic Street when she lived in Sinford, but that's by the by. But I think it was just social engagement.
I think there's some real hopelessness of some entrenched sleepers where we can look and say, well, we can offer you this and we can offer you that and you can have this and you can have that, you can have all this wrapped around. They don't want it. And we say, you've got probably, you carry on like this, you're likely to die, and they say, bring it. The level of hopelessness that occurs, we're talking about small numbers, but there are no simple solutions to people that feel as though, whether it's true or it's not true, and sometimes it's very true, their life from day one has been a catalogue of disasters. And trying to bring hope and engage that person in services where they feel as though they've been failed over and over and over again. It's years and years and years of investment of a very intense nature to expect to turn around that individual. So it's not easy. It's not easy at all in terms of what you do with those people that don't want to engage, and particularly those that have got multiple layers on them. And I don't profess to have the answers to that, other than keep trying.
I've got a question now on the stinging thing.
Go on.
So why can't a lot of these homeless be afforded the same amenities that they get down Midland Road in the hotel.
So,
You don't have to answer if you don't want to, but I've got to ask the question.
yeah, I mean, I don't know what level of amenities are offered to
I
those
could tell you some here if you want, but I really
those
don't want to.
hotels. But I guess I mean, my answer simply would be that the Home Office are responsible for those placements, and the government will dictate what it is that they are or are not entitled to, in the same way that the legislation tells us what it is that we have to provide and under what circumstances to.
The worst thing of that, as I see, is their availability to get NHS appointments and things. I can't get one. I went to the doctors because I got a problem, and they couldn't offer me anything for 5 weeks. I ended up at A&E for 14 hours. And that's what makes me ask that question, because I've got something on here that I could read out, but I'm not going to, because...
Is that fake letter you got?
Sorry?
Is that letter that's about...
Well, I have got that, yes, but it's...
That's, you know, that's fake, don't you?
Yeah.
That's
why I'm not reading it out, because it is what it is, but...
fake, no. Right, okay.
But that's not to dismiss the facilities.
I can only really
Okay.
answer.
I think you've answered that. If you want to follow it up afterwards, so yeah, feel free to. I think you've answered in that it would be for the Home Office to make any changes.
I've got to answer the question when we were here.
Yeah, I understand entirely. So now,
My question is answered, but I'll just make a quick comment. We've got a gentleman on top of on the train who's been offered a house in a bedroom, everything, and he's not taken, and he sleeps wrong. And you get those sort of people as well who just want to sleep over. And another thing is, you know, the pastures, the workers on Saturday night, they'll see them sleeping. They won't say anything till one's on train. The ones that sleep in the city centre, they'll move them on.
Really?
Yeah. And on the train, they won't move them on if they're sleeping on days. So, anyway.
The street pastors will move them on at the night time.
Yeah, that's it.
Okay. We could certainly take that feedback back and try and understand why that is. I thought that there was a reason to distinguish, but I don't know.
I'll let you guys take that one up afterwards. Councillor Court, and you next.
So I think last week there was a BBC article about, I can't remember which city it was, but a woman running a refuge, and she made a lot of points in the national media about the homelessness services for women specifically. I think it was last week, and that change needed to happen, and that the services available were very different, and often mainstream services weren't accessible for women, or they call, there was a whole host of issues about safety. So do we have? It seems like it was that city or that local authority, whoever it may be, doing something about it basically, and they pick this up to be a problem. Is that something that we're also seeing? Is there a difference? Is there any are more women rough sleeping now than before, or is it going down, or what are the statistics like in terms of what we have?
Yeah, so we have women's, well, I say we have women's specific services. We have domestic abuse service pathways where there are more women than men access those services, and within those there are women only facilities. In terms of rough sleepers, we have seen more women rough sleeping, and we have for some time now talked about developing, much as you're talking about, a women-centric service specifically. We are constrained by to be able to put that in place, and I think it's something that, again, if we were to have more resource, we would target in terms of bespoke practices of women experiencing rough sleeping and some of the dynamics that lead to that. I think we understand what they are, because I think we are doing work to better understand the profile of women rough sleeping. say, that's largely constrained by available finance.
Ringo, you want to ask a question?
Yeah, if you want to just go back to, I don't know if you get the slides up for me. The one about temporary accommodation. Could you go back to that one for me, please? I want to explore how much temporary accommodation is costing per night, per week, per month, per year. How much do we spend on it?
So the overall cost last year was about, in fact, we just looked at it today. The overall cost of all temporary accommodations last year was £8 million.
£8 million. Right.
So that's how much we spend, how much we get back in terms of having benefit, leaves a net deficit of about 1.4 million.
Which means my next question is, why aren't you buying homes left, right, and centre?
So the homelessness service, not buying homes.
Well, Derby Homes should be buying homes then.
I think it brings back into calling in supply. So there is a lot of work being done in terms of, because this story is a story of two halves. There's a story of demand, which is the homelessness story, and there's a story of supply, which is how do you get more houses that are affordable. So when I started and said kind of here's a national problem and here's how it affects us locally, there is a lack of available and affordable and suitable homes that impact homelessness. Then the flip side to that is, okay, well, where is the programme of increasing use of affordable private sector accommodation, increasing more local authority owned properties, and whether the local authority wants to use its Elmo vehicle to buy more properties. That all of those discussions are being had with projected figures, but they sit within strategic housing's supply portfolio, which is not Derby Homes' homelessness service, which I'm kind of presenting today.
Well, that's reason I just to talk about supply. There's 1,655 houses for sale in Derby at the moment. So we should be buying them left, right, and centre.
You are absolutely talking to the converted.
Let me preach to the choir, is that? So on that basis, may I make a recommendation through the vice chair?
Your vice chair can make a recommendation.
Well, I'll tell you what it is then.
Recommendation, but still waits as recommendation.
Well, I'll move on, then we'll come to recommendations in a minute.
Any further questions for anybody at all? Okay, so a couple from myself. So we mentioned that the count was done in November. I remember going on the count, I think it was in 2022, and it was said at the time that November winter time is one of the times we're likely to count the least number of people, because those people, never like to say choosing to rough sleep, but those people who could go to alternate premises, but perhaps in the summer would choose not to, will choose to in November because of the cold. So why do we count in November as opposed to, say, counting in June or July?
Yeah, so it's nationally driven. Everyone counts in November.
I thought it might be, yeah. And a second one then for myself was that obviously we've talked a little bit about sort of that addiction and dependency, which are of course big drivers of homelessness. We had a report come to us in, I think it was 2023, which focused more on the sort of antisocial behaviour side of things and touched on those elements. And a recommendation from this board that went up to cabinet, but I think was dismissed in the end, was around putting more funding into having more mental health professionals and addiction people trained in addiction and dependency to support rough sleeping and homeless populations. Where are we with things like that? What is the sort of provision at the minute, and how could we see it improving?
So there's a few bits to that. I think we use some of the grants to fund what we call multidisciplinary time. So Wilson Street surgery, clinical leads for mental health, for substance use, get together around a small cohort, particularly focusing on rough sleepers, those with multiple disadvantage. So we fund some, for want of a better, medical time to look more holistically holistically at those cases. In terms of additional services support, so mental health services, drug and alcohol addiction services, they are connected, particularly to the rough sleeping cohort through the MARSH, so the multi-agency rough sleeping hub. So that is a collective of those agencies that again have a caseload and work through, what's happening in terms of their addiction. Are they attending their appointments? Do we need to do something different if they're not attending, so that we can get them to access services as best we can? So there is work happening largely in that space. I think that it is very targeted at rough sleeping and not more broadly the homelessness service. And I don't think that there is anything bespoke for those that enter the homelessness service unless they're a rough sleeper.
Thank you. That was all for questions I had. So just one last time, any more from anybody at all? No, fabulous. And then to Vice Chair, do you have a recommendation?
Yeah, could we recommend that we bring in Derby Homes to ask if they are looking at increasing its stock of houses, please?
I'd be happy with that. I think
It's specific to homelessness.
Well, no, just like in general, wasn't it?
It's just in general, because obviously if you can have a lot more houses, you can actually move the people that really need a house there and also focus on homes as well.
So I think just on that point, Derby Homes, as the council's armour, is only one vehicle for buying or building council houses. The council can itself choose to invest in buying properties off the open market or building more, and in fact are already planning to invest in buying and building more properties. So I don't know if it would be helpful to broaden that request to look at, from a strategic housing perspective, what are the plans in terms of increasing supply in the city, including Derby Homes' response.
Yeah. So I think we'll formulate a form of words, but I think the overall theme then is to essentially bring a strategic housing report that looks at supply, demand, and availability.
Yeah.
I mean, Mr. Foote would be brought in. I like Mr. Foote.
I don't know both sides. I think.
Yeah, that's fine.
I mean, I'm happy to second that. We've all been in support of that. Yeah, fabulous. Brilliant. So that concludes our time on this report. Thank you both for coming along and for presenting to us. Very much appreciated. Fabulous. So that takes us on to item 6 on our agenda today, which is the work programme refresh. So looks like there's a slightly new approach to doing this for this forthcoming year. So Craig's given me a form of notes, which I'm going to read out as they are, because if I try and paraphrase, I'll get it wrong. It says, this is a short report about the new approach to setting the committee's work programme. A version of this report is being taken to the first meeting of each scrutiny board to get a unified and consistent approach. The report outlines some key principles of good scrutiny, reiterates some of the questions we should be asking as a committee when producing the work programme, and sets out an approach to working with other scrutiny committees. It's worth highlighting that the original published version made reference to a horizon scanning report. At some other scrutiny committees where the work programme refresh report has been considered already, there's been an accompanying horizon scanning report providing a strategic view of key future themes relevant to the scrutiny board to help better inform the work programme. Democratic Services have unfortunately been unable to arrange this for today, but committee have the option to consider it at the next meeting or to arrange an informal session outside the schedule of meetings to go through this. So we're sort of stuck a little bit without that horizon scanning report in being able to properly consider how we want to do the work programme refresh. So what I'd like to propose for this is that we await that report to be ready, see when that is ready, and depending on the time frame, either we have an informal Teams meeting between us all to go through it, or we bring it to the September meeting. Because if it's ready in 2 weeks' time, I don't think we really want to leave it to September. But if it's not ready till the end of August, I think we can justifiably bring it in September. So I think that's the best way forward for it, and I'm happy to take any comments or views on that. No, fabulous. So we'll feedback then to the team that that's how we want to go forward. And one of the things to get the committee's agreement on, so we have our schedule of meetings. Again, there's a gap between January and either June or July with a committee meeting for this. I'm not particularly happy with us taking 6 months off to not hold a meeting. So if it's okay with everybody, we'll arrange it close to the time, but we'll put something in end of March, beginning of April sort of time to hold another meeting. Okay, fabulous. So what I'll do then is, depending on how soon it's ready, we'll prepare something agenda-wise for that September meeting. We have already a VOG report coming at that time. We have a localities update coming in. There's been a bit of difficulty in terms of what to include in that. So I think potentially we'll hold that for the horizon scanning and see what that forms of. One thing I think we ought to consider, given the last few months as a report, is a community safety report on knife crime, because that has certainly been topical with the events that we've seen happen. And I think it's not something we've considered in the last couple of years, and I think we could do with a report into exactly what's going on, both in terms of the events that have happened and what we're doing to keep on top of it and tackle knife crime. If that's okay with everybody, I'll request that. And if anybody wants to request anything specific to be included, please do send an email over to myself and the Vice Chair. If you could ideally do that this week, and then I'll request the report at the start of next week with anything anybody sent to me.
Knife culture, antisocial behaviour, does that come into it also?
It would come in as a wider point. I'll certainly make sure that that's mentioned into it. But it's more if there's any specifics in terms of if we wanted incidents going back the last 4 years or the last 5 years, any specific reports we want. I think if there's any specifics, just make sure.
The knife culture recently, we've got quite a lot of instruments out.
Yes.
So I think we need to be looking into that.
Absolutely, yeah. That's my thought behind the report. It's not, if there's any kind of if you want ward breakdowns or anything like that, see if we can get any of the feedback from the knife sweeps and things like that that have gone off. So if there's any particular elements, please do just let me know. Yeah, that's a good question.
I'd be interested to know what this committee, in previous years before the different council have considered in terms of violence against women and girls.
Yeah.
In the community section, and then updates basically, because if we've heard that the homeless situation, there are more women.
Yeah.
It might be interesting to see how that relates to some of the other issues that we discussed.
Yeah, definitely. I'll bring that up and make sure that's included as well. And again, really for the VOG report as well, if anyone's got any specific recommendations on that, please do let me know as well. I would imagine I'll see if we can. If not, we'll look at it for November. If not, I think it's a case of whether Horizon brings up any other elements around that, because obviously housing is a big part of what we can cover as a committee. We've covered it sort of from a Section 106 perspective last year, and now we've looked at it from a homelessness perspective, and obviously now we're looking at it into a supply and demand perspective. So I'll see if a report can be ready for September once we know what Horizon recommends to us in terms of what to include. If they come back and say it can't be, then we can put it in for November. If it can be, then we can take a view either at an informal meeting or in the September one of whether that would be too much for a one meeting or whether we want to spread it out, how we'd want to do it. Certainly want everybody's views on that before we make a call. Fabulous. So with all that agreed, that brings us to the end of our meeting today. So thank you all for coming, and we'll formally close.